Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude the press conference. We're here again today to provide you with the most up-to-date information about COVID-19. Governor Newsom announced earlier today that the state of California has developed what he called a framework to begin transition toward a new phase of the effort to combat COVID-19. Governor Newsom began his remarks by recognizing the incredible effort millions of Californians have made to stay home and practice physical distancing. He said, "We all moved quickly as a state, and working together have bent the infection curve. The models have changed because of the effectiveness of our collective commitment to physical distancing, and I was very pleased to hear him say multiple times, there is a ray of optimism." The governor also said the next phase of the effort will continue to be guided by science and public health, not politics or ideology. Governor Newsom soberly said, as we move from suppression of the virus to living with it at a lower threat level until a vaccine is available, this will be the most difficult and challenging phase of all. This transition will require a new strategy that moves from a population-based approach to a more individualized approach. The governor pointedly did not announce a timetable for when his stay-at-home order would be lifted. In fact, he said it remains critical that everyone continue to stay home, practice social distancing, and rigorously maintain good physical hygiene practices. He explicitly said he does not view the state's stay-at-home order as a light switch that will be switched off and everything will get back to normal. A better analogy is a dimmer switch that will be carefully adjusted to account for new data and new conditions. Governor Newsom was also very clear about the fact that we are not out of the woods yet, but he also clearly said our current situation can't be a permanent state. The consequences of the entire state of California, shut in at home, unable to do business, is having a profound effect on the economy and the personal finances of too many Californians. He said we must get back to work, but we need to do so very carefully. The governor's new COVID-19 framework has 6 elements that to implement require detailed answers to very complex questions. The governor said he will continue to reach out to the best available scientific, medical, and business leaders to help answer the very serious logistical questions required to move through all the elements of this framework. Dr. Anzorg will describe the 6 elements of the governor's framework. Governor Newsom concluded his remarks today by saying he does not yet have a timetable for when his stay-at-home order will be eased. He suggested revisiting that question near the beginning of May because he wants a timetable but can't get ahead of answering the very difficult questions that need to be answered. Our message continues to remain the same. Please stay home. When you must go out, wear a face covering and stay at least 6 feet away from others. Regularly wash your hands, avoid touching your face, and disinfect surfaces. If you feel sick, isolate yourself at home. If your symptoms worsen, call your medical provider and follow their advice. I'd like to close my remarks today by highlighting the important work our local professional journalists do by helping share public health information to our community. By providing accessible, accurate, and timely public information during emergencies, it is critically important to protecting our community. We can't do this job without the dedicated hard work of our local journalists. In addition to broadcasting the county's updates and raising public awareness about COVID-19, our local journalists ask important questions. They aren't always easy to answer these questions, but the questions encourage us to look at the issues we face from different perspectives and help us better understand the concerns of the community. Like many others that are responding heroically to COVID-19, our local media outlets are working around the clock to provide a very high level of service. They're also working to do more with less. as their funding is reduced during this very difficult economic time. If you value and understand the importance of local news, please consider either subscribing or financially supporting local journalism. Just like how you may use restaurants and takeouts to keep those restaurants open and functioning during this difficult time, please consider subscribing to one of our community's local news publications. We all rely upon them to keep us informed about COVID-19 and other important local news. Thank you to all the journalists who are here in the room today and those that are on the phone. I'd now like to introduce Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. Today we are reporting 29 new cases in Santa Barbara County, which brings us to a total of 313. 13 of the 29 new cases are related to the outbreak at the federal prison in Lompoc. Of the 313 cases, 133 are recovering at home, 124 have fully recovered. 40 people are hospitalized, 15 of them in the intensive care unit. The ages of new cases range from the 20s to over 70 years of age. Our current numbers are reflecting an ongoing increase in total cases. Fortunately, though, the number of hospitalizations and especially intensive care unit cases has remained fairly stable or is slightly decreasing. The county caseload is impacted by an ongoing outbreak at the federal prison. Right now, we have 67 cases in inmates, 12 of which are hospitalized, and of those 12, 2 are in intensive care unit. 24 employees of the prison have COVID-19, and 1 is hospitalized as well. The Public Health Department has intensified our cooperation with infection control and medical teams at the prison, and we are supporting the Bureau of Prisons in their effort to stand up a field hospital on the prison grounds in order to offload the burden on the local hospitals. Progress on this project is being made, and we will update you on new developments. Meanwhile, the Public Health Department is actively testing, isolating, and quarantining prison staff in order to limit further spread of the virus. Earlier today, Governor Newsom, in conjunction with the State Public Health Officer, Dr. Angel, and the Director of Health and Human Services, Dr. Gali, presented a roadmap for a stepwise transition into the next phase of mitigation of the COVID-19 pandemic. In summary, it outlines the necessary indicators that need to be in place in order to be able to responsibly modify our current stay-at-home order. For this to be a possibility, we need to have sufficient testing available to rapidly identify and isolate infected persons. Our public health infrastructure needs technical support to manage and care for our isolated infected individuals and to find and quarantine contacts to reduce further transmission. Second, we need to have solid plans on how to support the elderly at home and in senior living facilities, as well as other vulnerable population, so that they are able to stay at home safely. Our healthcare system needs to be able to meet the need for anticipated hospitalizations and intensive care unit healthcare. Meeting the need also means that hospitals and other care sites must be able to protect their staff and patients with enough personal protective gear. Our state will need the ability to develop treatments or therapeutics for COVID-19 disease. Schools and businesses need to adjust structurally and organizationally to be able to allow for social distancing and to be able to provide enhanced regular cleaning and disinfection of the premises. Finally, we need to be assured that we are able to reinstate any protection measures as they are needed. Once our current infections as well as hospitalizations start to decline and these 6 parameters are in place, a gradual opening of certain businesses and modifications to the stay-at-home order will be implemented. For Santa Barbara County, the timing of this transition will follow the state's public health guidance, but will also be tailored to our local needs. In order to prevent a second wave of infections, we will need to monitor our local disease activity very closely, and we will need to be prepared to transition back to stay-at-home orders or other measures as needed. I am anticipating that by the end of April, we will have a better understanding of how our local situation is unfolding and how efforts at the federal and state level will help us better access testing, treatment options, and other resources. We are fortunate to have robust partnerships that will aid us in our local response. Until then, we need to stay the course. We need to continue to wear face coverings when in public, practice strict social distancing, and exceptional personal and environmental hygiene measures. I'm grateful to the community for the continuous effort which is protecting everyone. Thank you.
Thank you, Dr. Ansberg. Next, we'll hear from Dr. Stuart Comer, the Lab Director for the County Public Health Department.
Thanks, Supervisor Hart, and thank you, Dr. Ansberg. So COVID, by the numbers, I think at the present time, the county has done over 3,200 cases. And one of the things that Dr. Ansberg wanted to know is, in general, what is our testing rate? And our testing rate's about 0.77%, a little less than 1%. If you compare that nationally, the national average is about 0.87%. So we're actually very close to what the national average is in terms of the numbers of patients that we test. And you look at the positivity, our positivity is about 8.5 to about 8.8%. Part of that reflects the uptick in Lompoc, but it has stayed very, very steady, except for the Lompoc contingency. And I think that's very encouraging. As Dr. Ansberg pointed out, the number of hospitalizations has remained very stable, and for that we're extremely grateful. So that, I think the point that both Supervisor Hart and Dr. Ansberg made is extremely important in this regard, because this is showing the effects by the numbers. In terms of current testing capacity, since we talked last Monday, what's very helpful, when we started this, all of our testing was off-site to different counties and to the state. Now all of our rapid Tier 1 testing is done in Santa Barbara County. All 5 hospitals have access to testing that takes less than 12 hours. And 2 of the 5 hospitals, Marion and Santa Barbara Cottage Hospital, both have access to very rapid testing capability for their inpatients to less than 3 hours. So I think that's been a very, very positive development during this time frame. And I think one of the things that's important, again, to Dr. Ansberg's strategy has been really Tier 1, the focus on Tier 1 testing, and that has been very, very effective. The question is going to be, how do we transition to the next phase when you start looking at general population testing? This is a question that we get not infrequently about testing for antibodies and then testing larger groups. And at the present time, that's going to be one of the difficulties. I know that Governor Newsom and his task force have some very, very brilliant people working on this, and that's going to be the next key. How do we transition to larger scale testing so that we can test more of the general population and or establish the likelihood that they might actually have antibodies? And one of the difficulties that we have that comes up with serology, and I'll just bring this up, serology is the blood test that we test for the antibodies. If you look at the 4 common coronavirus types, we looked at our rates of the 4 common types, the seasonal coronavirus. We have a 5% rate. We looked at 2,613 patients that we tested from 1 November to the end of February. And so patients who have already had typical or seasonal coronavirus are the ones that still may show up as positives and false positives if we do have a COVID-type serology test. So that's one of the difficulties we have. And the other difficulty we're going to have is there's a certain percentage of patients that never, although they've had COVID, they don't actually develop the antibody. And that some indications are from the University of Fujian in China is that it might be 6% or higher. So that's one of the things that we're going to be working on and more to follow as the weeks progress. But I just thought I'd provide that information in case that people have those questions. Thank you.
Thank you, Dr. Comer. That's very helpful to have that detail. I also asked Jennifer Smith, who's the Executive Director of the Legal Aid Foundation of Santa Barbara County, to join us today to share information about the services that they are providing to members of the community during this very difficult time. Legal Aid is a nonprofit law firm that provides free, high-quality civil legal services to low-income and other vulnerable residents in order to ensure equal access to justice. Jennifer?
Wonderful. Thank you, Supervisor Hart. I'm here today to let everybody know that Legal Aid is open for service. For the safety of our clients and our staff, we are working remotely from our homes, but we are fully operational for service. And we provide legal assistance in certain areas of law, and I wanted to highlight a few of those programs. So first, we advise tenants who are at risk of eviction. Second, we assist survivors of intimate partner violence, elder abuse, and sexual assault with restraining orders, custody orders, and related services. And we also advise on foreclosure prevention for homeowners who are concerned about making mortgage payments and maybe at risk of foreclosure. In addition, we staff the Superior Court Self-Help Centers, which are known as the Legal Resource Centers. And these services are also available for service by phone. And with this type of service, you're provided self-help assistance. The attorney does not serve as your representative, but gives you the information that you need to assist yourself. And I wanted to touch on some of the legal issues that we've been hearing about in our community since this crisis began. One of the issues we're hearing most about is the area of residential evictions. And so first, everybody should know that evictions should not be taking place without a court order. And right now, the courts in California have suspended almost all eviction activity during this public health crisis. We've heard some anecdotal reports of landlords violating the law and trying to lock people out. And it should be known that illegal lockouts are a crime. And so if there is a tenant that does receive an eviction notice or any court paperwork, they should seek legal help right away. In addition, tenants who are having trouble paying rent because of COVID-19 or the impacts should seek legal assistance right away. The governor and various local governments, including the County of Santa Barbara, have passed some emergency protections for tenants. But in many cases, the protection is not automatic. And so the rights and responsibilities of tenants vary depending upon where you live. And in most cases, the tenant is required to notify a landlord in writing that they've been impacted by COVID-19. So for example, you've lost a job, you've had a cut in hours, that sort of thing. And you must also provide proof of that you cannot pay all or part of your rent. And again, your rights and responsibilities vary depending on where you live, and we strongly encourage any tenants to seek legal assistance. And then, unfortunately, anytime that there's a crisis in our community, our residents are vulnerable to scams. And there's various different types of scams, but in general, residents should be skeptical if anybody solicits or reaches out to you to try to get information from you. Make sure that you're initiating contact to trusted sources of assistance. And so again, the Legal Aid Foundation of Santa Barbara County is open for service. You can get all of the information about our services. Our contact information is available on our website, which is www.lafsbc.org. Again, that's lafsbc.org. We have offices in Santa Barbara, Lompoc, and Santa Maria, and you would simply contact the office nearest to you. As you might imagine, our staff is very busy assisting callers, so you may need to leave a message. And if you do, our staff will return the call.
Thank you, Jennifer, and thank you to the entire legal aid team for all the work that you're doing to help our most vulnerable neighbors. Now we'll go to questions from the room. Who would like to begin? Brooke, hi.
What trends in cases and hospitalizations do you need to see as public health officials before you feel confident changing policies for restaurants, non-essential businesses, etc.?
So we are looking for a plateau level of hospitalizations and intensive care unit cares, but then we are actually looking for a decline of cases. And this decline cannot just be a couple of days. It has to be sustained, and it has to be ongoing for probably a couple of weeks until we can have that discussion.
Ms. Lair?
I'm Tracy Lair with News Channel, and I am asking, there's some discrepancies in the Bureau of Prisons numbers for the inmates and our numbers, and I wondered if you could clarify the numbers.
Yeah, it's confusing even to me. Sometimes it's because the cutoff when we start counting the numbers is different. So our cutoff is at noon every day, and the prison's cutoff, I think, is 3 p.m. or certainly at a different time. They are trying. It's actually improving. Over the last couple of days, it should have improved a little bit. But there's always a discrepancy just because of the cutoff times. And then again, also some staff members live in San Luis Obispo, and the counts go towards the San Luis Obispo count, and that will also impact the numbers slightly.
And my other question has to do with a Camrio man's plasma was used by Vitalant to give to someone sick at St. John's in Oxnard, and I wonder if this county is thinking about using plasma to try to see if they can make some of the people in the ICU better.
Can you speak to that?
Yes, matter of fact, we're considering that currently. The differences, there's still not a lot of availability. The blood center that actually they use is the one that also serves most of Central Coast California, and they do not have any more of that plasma available, but we are seeking some from the Red Cross to try to do a similar evolution and using convalescent sera for some of the patients at Cottage. But at the present time, that's still being worked on.
Any other questions here in the room? Next, we'll go to the phones.
Yes, we've got several. Tom Bolton with Newshawk, go ahead.
Hi there, good afternoon. My first question is for Dr. Colmer. If I understood correctly, you indicated there's been about 3,200 tests that have been done so far. And I'm just wondering what's been happening with the rate of testing. If you look back a week or 2 weeks, how many tests were being done then versus how many are being done today?
Tom, I think that the major issue is it continues to ramp up, and I think the advantage is when we first started, one of the problems that we had is we really overwhelmed a lot of the reference labs, the national reference labs. And so if you looked at our initial statistics, you'd find that we kept sending specimens, but we also had some that were untested. Now that number is less than 2%, so it actually reflects testing for that day. So the numbers of cases ramp up considerably. I think the important thing, Tom, though, is that we still go off of the critical approach to test symptomatic patients that are basically tier 1 and some tier 2 type patients. And I think that's the key focus on that. The idea of doing general population testing at this point, no one really has the capacity to do this. The reason I bring this up, Tom, is it came up with the state of California. There are several counties, rural hospitals in California that can't even do tier 1 testing in their hospitals. And yet you have some cities like San Francisco and LA that are basically doing some general population testing, and people don't quite understand that discrepancy or disparity, because the reality is going to be what you really want to do, and I think Dr. Anzorg had this correct, how you handle pandemics is you really test your tier 1 type patients that are symptomatic, and I think that's one of the difficulties that we have. We could rapidly overwhelm the ability to test if all of a sudden we just open the floodgates and let all general population testing occur. That's one of the key challenges that Dr. Charity Dean, the task force head for Governor Newsom, is dealing with right now. They do not have a good answer for that at the present time.
Okay, and I certainly understand that, but again, are we testing more people today than we were testing a week ago, or they were testing 2 weeks ago, and on sort of what magnitude?
Yes, Tom, absolutely. We're basically testing all tier 1, so it's probably 15-20% more than we were before.
Okay. My second question, I'm not sure who it's actually for, but I was asked recently by of somebody who works at a homeless shelter. There's a number of people being released from some from the Lompoc prison, but more from Santa Barbara County Jail. I'm wondering what efforts, if any, are being made to ensure that those people have a place to be, if you will, somewhere that they can go shelter in place. Because the indication I got was at least this one shelter didn't really have the ability to do that.
Yes, all of those prisoners that are being released from county jail, and also the prisoners that are being released from the state facilities, are being counseled by behavioral wellness department staff and probation staff to find out what their arrangements are prior to leaving the facility for housing. So they are checking to see if they have plans to stay with family members or other arrangements, and they are also working on a housing plan for those individuals. The ideal resolution will be that all those people do have a place to live when they are released from jail or prison.
So a homeless person released this afternoon is going to have a place to go, or might have a place, or that's something you're still working on?
Well, I think it depends on where they're coming to us from the system and at what speed. The initial release of, I think, approximately 20 prisoners from the state prisons, the Department of Probation felt as though they were able to take care of all those folks. But if there are additional releases that are coming from the state of California, that may be more challenging.
And from the county jail?
The county jail, I believe they are also, probation is also working with those individuals to find placement of housing for them too.
Okay, thank you very much.
Right next, we have Reza with San Ynez Valley Star. Go ahead.
Hi, everyone. Thank you so much. I really appreciate Supervisor Hart's message on journalism. So I have several questions. This one is for Dr. Ansorg. The patients that are in the hospital, or at least the ones that are recovering from home, has there been any, I guess, testing or the use of vitamin C or zinc as modes to get better? I've read several reports that hospitals that are using high doses of vitamin C and or zinc, like what's in broccoli and spinach, has been proven to be really good for getting people better.
I'm unfortunately not aware of any studies pointing that out, but maybe you can send me the link and I'll take a look at that.
Sure, I would love to. Also, the patients that are on the ventilator or have been on the ventilator, what are the success rates of them coming off the ventilator? And how long are they on the ventilator before more questions are asked?
Several of the ventilated patients were successfully weaned off the ventilator. That's the lingo for taking them off slowly, and which is really encouraging. And the time for them to spend on the ventilator is relatively long, about 2 weeks average. I'm aware of one person who was able to come off within a couple of days. However, the average is closer to 2 weeks.
And I'm not sure who might be able to answer this question, but back to the prisoners that are being released, are you aware of who they are and level of crimes that they may have committed, and or telling, people in their prospective neighborhoods, if people are concerned about, redoing their crime?
The prisoners that are being released are low-level offenders who have been screened to evaluate the appropriateness of that early release. In many cases, it is just a matter of a few weeks reduction in the length of their sentencing, and people who have committed domestic violence or other violent acts are not eligible for early release.
Great. And Dr. Comer, this question is for you. Sorry, I have a few questions today. The people who are interested in doing the antibody testing, I believe I asked this question a couple weeks ago, but maybe has there been anything done to maybe have people draw blood now in hopes that they can be tested in the future when that becomes available?
It's a good question. I mean, at this point, there's no policy in place to actually draw now to find out. Because remember, if you have the antibodies, we do know a lot of these studies actually came from seasonal coronavirus, and Dr. Fauci reaffirmed this. If you have the antibodies, if you were exposed to that, we know that generally you hold those antibodies for the better part of about 12 to 13 months. And that's why Dr. Fauci had said, if in fact you were exposed to this virus before acute testing became available and you actually had it, the reality is you're going to be protected going into the basically the summer and fall of this coming year. But we know with seasonal coronavirus that generally after about 12 months, a significant portion of patients actually lose that immunity and their antibodies fall below a certain critical cutoff that establishes that immunity. So it doesn't make a difference if we draw you now because in the next few months when we actually have an antibody test that we think is truly of the appropriate performance availability or performance characteristics that make it worthwhile to offer, you will still have those antibodies and they'll be detected. Does that help?
Yes, definitely. And I'm sorry if I'm overstepping my bounds. Can I ask one more question?
Yes,
and
go
this
ahead.
might be for the legal aid, Ms. Smith. On evictions, if somebody was already in the process of being evicted before, let's say a commercial business that wasn't affected by COVID at the point of when they were originally started the eviction process, is that on hold now?
The information I provided is on residential evictions. However, my understanding of our courts as a whole from the superior courts is that they're hearing and processing emergency matters only, and that evictions activity generally has been suspended.
Okay, thank you.
Thank
That's
you,
it for me.
Reza. Next, we're going to Nick Masuda with Santa Barbara News Press.
Questions. Thank you very much. This is for either one of the doctors. I know you guys spoke to waiting for a decline in cases to kind of start thinking about the next steps. With us only testing tier 1, do we have to wait for a general population sort of testing before making that determination on whether or not it's declining?
Well, you have a two-tiered question. So the first one is maybe a misunderstanding. So we are not looking at the general cases. We are looking at decline in hospitalization and intensive care cases. So if those go down, then we feel comfortable that our hospital would be able to successfully take care of an equal amount of patients or a slightly larger number. So with regard to your second part of the question, I'll refer to Dr. Comer.
So in terms of general population testing, again, the question would be would you test them to see if they are asymptomatic carriers and still shedding virus, or would you test them for immunity? And that's the difficulty I think that we addressed earlier. We just don't know the answers to that just yet. We know that we do not have the capacity. I mean, if you look at this, less than 1% of the entire population of this nation has been tested. What would happen if you wanted to now test literally millions of people? We're right about 2.9 million people who have been tested in the country. Think about trying to scale that up to 10 to 20 times that amount. So to answer your question, that's exactly what Governor Newsom wants to do. It's one of his parts of his 6 plans to do that, and we just don't have a good answer for you yet. but that's what everyone is looking at, because we want people eventually to be able to go back to work but in a safe, basically as safe environment as possible.
Thank you. One more question. This one's for Supervisor Hart. I know a couple weeks ago you had announced that Santa Maria, the high school, is going to be used as a homeless shelter. Are we any closer to a solution in the South County where there might be a extra facility to house those folks?
Yes, we're pursuing a different strategy here in South County that would involve hotel rooms, and we are getting closer. We're working through the legal lease language with the potential operator of a hotel, and we were hoping to have some news to report about that today, but it'll be coming later this week.
Thank you. I appreciate it.
And next up, we have Laura with Santa Maria Times.
Yeah, so I had a question regarding tracking patients confirmed for COVID who are being hospitalized right now, because I know of one patient who was hospitalized in North County who ended up being transferred to an LA hospital to be put on an ECMO machine just for further more intensified care. And I was wondering if the county is keeping track of other patients who have been transferred for further care to outside hospitals, and if that's a number you could cite today.
Do you know anything? No. I can speak more broadly. I mean, just so you know, people get transferred down to either the LA area to tertiary care centers that have better capacity to handle some of these more complex patients, or up north. So it's not uncommon for that to happen. It is not our belief that actually that is occurring with any significant degree. Certainly at Cottage I can speak to that. We're not seeing significant numbers having to be referred to higher tiers of care in order to meet their medical requirements.
Okay, but it's not uncommon for that to happen?
No, okay. and we do it all the time. Even in a non-pandemic scenario, we end up sending people for specialized, things like transplantation, et cetera. So it's not uncommon to do that.
Right, yeah. I was just asking in regards to, if a ventilator wasn't supporting someone enough and they needed to go for, say, an ECMO or another machine like that. So, okay. And then my next question was just seeking another update regarding the number of healthcare workers. And I was just wondering if there are plans to maybe release that number, if possible, more frequently. And I guess that just depends on how you all gather that data, which is something I'm also interested to hear a little bit about.
Yeah, we have currently 38 healthcare workers, and that's just an increase by one from last Friday.
Okay. Can you speak a bit to how just you gather that info of which healthcare workers are confirmed, or the number of healthcare workers confirmed? Does each hospital report that, or do you just go through your different tests confirmed and have to track it back to whether that person is a healthcare worker?
Well, we get that information by a phone call. When somebody's registered as a positive COVID case, that person gets investigated by our disease control team. And that is part of the questioning is, in particular when they got sick, what they were doing. We ask their personal information, age, gender, ethnicity, where they live, what they do for work. And then we broaden the questioning with regard to their contacts, because we want to identify contacts in order to quarantine them. And that is routine disease control. It's a little bit like medical investigation or police work.
Okay, thank you.
Mm-hmm.
Thank you, Laura. That is all the calls that we have.
Thank you all for being here today. Our next press conference will be held tomorrow at 4:30 p.m. We'll continue the daily press conferences through Friday of this week. The live call-in center has now transitioned to the 211 line, so if you have questions, they are available 24/7 in multiple languages. You can just dial 211. The Emergency Operations Center is working very closely with the 211 information operators to ensure that they have the most up-to-date information about COVID-19. And as always, the phone numbers and websites of the various resources and information will scroll on the county television screen after the press conference ends. Thank you for joining us today. We are done.